do we need to support women having children because it's necessary for the survival of our society? And we do. And we do. Do we need women to be healthy? We do. And do we need children to be healthy? We do. And so health insurance is not a good model to incentivize that or support that. So we need to start looking at out of the box solutions that lift pregnant moms and young children out of poverty and provide them with a leg up so that they have a healthy future, because it's all selfish. They're going to pay for my Medicare and my care as I age. And without a strong economy, this whole democracy thing that we have,
Gonna
which is
collapse.
great, collapses. And
Yeah.
I'm too old. I can't start all over again. Okay. So I need these young kids to be
You're
strong.
talking to me. My husband is online in the evening looking at homes in the UK to move to, which is where I came from.
I'm moving back to Colombia, and it mortifies my dad. He goes, "Why?" I said, "Because in some cultures, the age, I can't say old, are
Yeah.
treated with respect and kindness.
Yes.
So I'd rather live in a little apartment where I can afford a maid and a driver, and than in a nursing home."
Oh, brother.
Right? It's
Okay.
true.
But
And
ultimately, we are in a society right now that doesn't even have parity with Medicare for our children, right? So we're not valuing our children. We don't even pay attention to it. It's a small, they don't vote, they don't have any kind of influence. And so we're not, and those of us that are advocating for them, we don't have a lot of influence because there's not a lot of us either. We don't have a lot of power. And so we can do our best to try to raise the voices. But until the society and the community values children, ultimately all of this is sort of, unless we separate it out as a separate program. This is not a healthcare program. This is a preventive medicine program. This is your sick care program. This is your well care program.
but I think if you talk to anybody, I don't care how far right libertarian, that we should do away with K through 12 education, they tell you you're absolutely nuts, and they would stop talking to you.
Should talk to some people here. There are people here who think really they don't want to get rid of K through 12 education, but they really don't necessarily think we need to be doing all the things we're doing in K through 12 education, and it should cost a lot.
Okay.
Yeah. The best
And I
years,
think if you ask most people, is it ethical not to
No,
invest?
I agree. I agree completely. But I think
The
most people,
conversation changes. They're like, most people, like say 90%, 80% of people say it's not ethical not to invest in the future. People feel that the baby might not vote, but the mama votes and the
Mhm.
grandparents vote. And if you make it you really want your grandchild to grow up sick?
Yeah.
which the
But
business,
when they go to actually vote, they don't always vote based on their ethics.
yeah, the people that are running the business,
Oftentimes they vote based on their concern about self, their
Yeah.
self-interest.
Right.
So
Or their
their
one issue,
emotion and their self-interest.
their
Exactly.
one issue,
Yeah. And so even though theoretically they might say one thing, when they go to the ballot box and they go to vote on whether or not to increase their taxes to pay for a new school building, they vote against it, even though they do feel like K through 12 education is important.
Yes.
Yeah. And that unfortunately is the reality. That's why we have no parity with Medicaid in most states across the country.
in the healthcare industry, it's run by MBAs, administrators, all these non-doctor people, because doctor, you go in the room and do what you do best. We don't care about your opinion. Who has some ethics?
Right.
Business people, they don't have ethics. They do money. It's as simple as that. I don't know if you were around, Sean, when President Obama was in charge, they made parity for Medicaid lines of businesses.
Yeah.
Everybody was at 100% parity.
Yeah. Great.
That's great.
Yeah.
What's wrong with that?
Yeah. There's nothing wrong with it.
That's
You
what
know?
we don't
Okay,
want.
here's what was wrong with that.
And the second that it wasn't required anymore, a
It went
lot
away.
of states it went away, right?
Yep.
Because even though they thought it was ethical and they thought it was a good idea, they still had to make their budgets balanced.
Yep.
Okay.
Yep.
And they didn't have the money and they didn't want to raise taxes. And so it went away.